It a bit more formal. My name is Judith Adolescent. I work at the Netherlands Embassy as a policy officer for sexual reproductive health and rights. Today I'm here to share some insights with you as in the capacity of chairperson of the donor working group on sexual and reproductive health and rights. And within this group, we have a very strong focus on adolescents, and that's why I was requested to share these insights. And I have to say it's a great honor, but also a responsibility at the same time to address you today. I was requested to talk about the strategic outlook on financing for adolescent legal and health outcome. But before I go into that, I want to start with a question. What if I told you that the single most powerful investment that Uganda can make today is in her adolescents? Do you agree with that? Can I hear why you don't agree? I want to hear the one who doesn't agree and the one who agrees. All right, I'll spare you for now. But we can all agree that the future of every country depends on the young people of that country. The elders are going to go, the current leaders will go, but the young people will take over tomorrow. So this is about a very important population of Uganda, a population that will define what Uganda will be in the next 30 years. So the issues we are talking about are issues that defines the nation 20, 30 years from now. What we know is that adolescents, that I'm sure you all understand now, it's between the age of 10 to 19, makes 25% of Uganda's population. So 25% of the 40+ million people are young people. And we know that this is a stage that is a very critical and fundamental stage for human development. So I want to bring it from this angle because the conversations you've been having the last 2 days is a conversation that touches a very critical phase of any person's life. A human being is born as a child, becomes an adolescent, and becomes an adult. So adolescent is a very critical stage. It's a stage of transition that will involve rapid physical, cognitive, emotional, and social transitions. I came when the panel was talking about children who are being raped and all that, sexual violence. All those are issues that young people have to grapple with when they're trying to do transitions within the social life in which they live. Now, what's very important is that this phase of life will always affect how young people, how adolescents will feel, they think, they make decisions, and also how they interact with the world around them. And it's very important that out of these 2 days of engagement, you also can realize that during this phase is when people establish patterns of behavior. An adolescent that has experienced violence, a boy that has seen violence, is likely to be a perpetrator of violence. So these are very crucial stages that the patterns of behavior that young people will form and their experiences of interactions around them at that time can either protect their health and the health of those around them, or can also put their health at risk as well as the health of those around them. So the discussions you've been having concerns a very pivotal window for laying the long-term foundations for health. And I hope that you've been carrying the last 2 days with the weight that it carries. And I'm hopeful that your post-conference engagements will be a challenge for you to realize that you're dealing with matters of life of people, and we need to deal with them very carefully and very intensively. I have to share with you that there is a very big wrong understanding around adolescence. People think that adolescence is a very healthy stage of life. People assume that that stage of life should ideally be a very healthy and good phase of life. And in reality, that's how it should be. In reality, in an ideal setting, that's how it should be. But evidence in our own context shows that for many adolescents, it is not an experience of good health, as would always be assumed, especially by we adults. And we have statistics that really speaks to this, and these are statistics that I believe you've been hearing about since yesterday. But these statistics is a revelation to us that adolescents are not experiencing health in the way it is assumed that they should be experiencing. You've heard about the teenage pregnancy, where the country has been at a rate of 25% of girls at any one point has survived childbirth or is pregnant with her first child. 25%. So if we are how many people in this room, if you got 25% of that, you can get an idea of the magnitude of the problem. I don't think it is acceptable that a girl, a child, should be carrying a child. And we get from the Ministry of Health that out of all the mothers that are dying because of childbirth and related pregnancies, of related complications of pregnancies, about 12 to 17% of them are adolescent girls. So when you see the maternal mortality, the number of mothers that are dying because of childbirth, 17% are adolescents. And if we are to say 17% of adolescents, can I have the hands of the girls who are below 18 up? The hands of girls in this room below 18 years. Have you seen them? It means these are the girls we are losing. And as we talk, one of them out there is struggling with life. So this is how serious this problem is, and we don't really take it for granted. We've heard about child marriages. Child marriage is still very high, with 40% of girls being married off by the age of 18 years. So you can imagine how much we are grappling with. We are seeing new HIV infections increasing among young people, and particularly among adolescent girls. And just the last point on the statistics to just help us appreciate the magnitude of the problem that you have been discussing in the last 2 days. Concerns around mental health of adolescents. And I'm sure everybody would wonder, but what is worrying them? They don't have any problem. Your parents are there taking care of you. You would imagine that these are young people who should be enjoying good mental health. But that's not the case. They are going through a lot of mental health related challenges. And a UNICEF report a few years ago tells us that 25% of adolescents report symptoms of depression. And this rate is higher among girls. and 11% of adolescents have committed suicide, attempted to commit suicide. So when we really talk about health and we talk about access to justice, we are talking about issues that are taking people into the grave. When a girl is raped and her future is lost and she cannot be accorded the justice she deserves, what more do you expect? Lack of access to legal services are some of the things that cause frustration in people's lives and can lead to all these kind of mental health consequences, including death, that we have just been mentioning about. So I know you've been having quite some conversations already on what do we need to do. I really think we all know what to do. We know what to do, we know what works. It's just the challenges of why are we not getting it right? Why are we failing to do what we should be doing to change the statistics that I have just talked about? And very sadly, all these things are preventable. All these challenges that young girls and boys are going about. Talk about suicide, talk about HIV infection, talk about death. All that I have mentioned are preventable death. We cannot say it was meant to happen. These are preventable harm that we are failing to prevent because we are probably not doing the best things that we should do. We are doing it, but we still have to do it much better. And for those who come from the medical ground, you know how painful preventable death is? It's very painful to lose someone from a condition that you know you could have stopped. You remain haunted, and I hope we will remain haunted for all the data, all the statistics, and I really hope you will go back motivated to do more than you can do. I know some of the challenges within the systems are beyond us, but we are the very people who work in these systems. Systems exist, but systems and processes of systems are implemented by us people. So when systems are not working, it means we, the people working in those systems, are the ones failing the system. So my challenge to each and every one of us, which part of the system are you coming from? And what can you do differently in your capacity to change some of these things that perpetuate poor health and well-being for young people? I know you've talked about it, but I think listening to the panel discussions, for us to prevent some of this harm to young people, access to information, including age-appropriate sexual and reproductive health information, is core for young people to continue having. Young people need opportunities to develop their skills. Young people need health services that are acceptable, equitable, appropriate, and effective. Young people need safe and supportive environments within the home, within the schools, and within their communities at large. And lastly, I want to also emphasize, young people need opportunities to meaningfully participate in the design and delivery of interventions that will improve and maintain their health. Jackie was joking that when she walked in, it's one of those meetings where they say it's for young people, and a big participation is from young people. And I asked Jackie, what are we doing in this room? But we are here to share experiences that we gathered also in our days as young people. We did not just suddenly become old women. We were once young people like you. You will also get here, I promise you. You will get here. But before you get here, enjoy that phase as well. So expanding opportunities that is key to responding to adolescent-specific needs and rights. I'm very happy that this conversation is beginning to shift from just service delivery to rights of adolescents, because I think that's where the conversation of accountability starts. And I'm very happy that you've brought this, anchoring the rights perspective in the conversation. We all know that the government of Uganda ratified the UN Convention on the Rights of the Children, and indeed what you're discussing here, if I can also reflect from the panel discussion that happened, is just discussing what Uganda should be doing, because it ratified this instrument, it has domesticated it, it has put in place everything that we need to protect the right of a child, whether the right to life, to education, to health, to protection from harm, to express their views, the right to rest and play. Uganda has it all. But I think, as the officer mentioned, it's the poor implementation of these instruments that the country has domesticated. So in terms of legal frameworks, for sure, we have it. It's just the implementation. We might say the situation is very bad. It's really bad. But I think we also have to acknowledge how far the country has gone in making progress. I know progress is being made, but the progress is not the progress that I'm sure we would want to see. So all these conversations, I believe, are intended to accelerate, to accelerate progress and to accelerate gains. It's not that there is nothing happening or the country hasn't done anything, but I think it's more the question of how do we accelerate the gains that we have so far made. In ending, ladies and gentlemen, I just want to make a few comments on the funding landscape. It's true. I have been seeing the list of all these partners, and I was trying to look at which ones are receiving funding from the Netherlands, and I could see like 80% of these organizations are receiving funding from Dutch government. That's just as an example. Now, we all know what is happening with development cooperation. That's the truth. And we know that in Uganda, a lot of programs, whether around health, whether around protection, plus many others, have been externally financed. Now, with what is happening, it means financing for all these issues is certainly going down. And if the financing from external donors is going down, what happens? You start to look in-house. You start to look for what's within us, what's around us, and what are some of those untapped opportunities. Am I wrong or I'm right? Because external development cooperation funding is going down. That's the truth. The picture is not very good, but that's the situation. Now, I have about 4 main things that I want to share with you. From all the conversations you've had, what comes out very key is that adolescent health, including access to justice, is a multi-sectoral issue. It is not an issue that one sector alone can advance. It needs to be approached multi-sectorally. What I have to say is that we are very lucky that the government of Uganda has also changed its way of implementing its development plan. And the shift of government from sector, where we used to engage more with either with health or with education or with gender, is shifting. Government is moving into a multi-sectoral approach. It therefore gives you the opportunity as stakeholders to also start a multi-sectoral approach to handling this or in addressing this matter. So for the government programs, for some of the partners who may not know, there are all programs are very important, but there are 2 critical programs of government. The Human Capital Development Program, and then the governance and security programs. So if in the past you have been looking more into health, education, gender, it's now time for you to start looking at it from that perspective. And government has already created the avenue through which as civil society you can engage. So those are two relevant programs that I want to interest you to start following up as civil society and to see what opportunity it offers, how that shifts the kind of advocacy work that you even do as civil society partners. So those two programs are very important for you to advance a more programmatic approach and a more multi-sectoral approach. Where there is now very little funding, you have to become more efficient, you have to work multi-sectorally. So you have to leverage the opportunities that these government programs do, and you have to now structure your advocacy with a multi-sectoral lens as well. So that's one thing I would talk about. And as civil society, you can engage in advocacy for domestic financing to these programs, because these are the programs that will help you in approaching the challenges around adolescent health and well-being in a more multi-sectoral way. The other second thing is advocating and lobby for multi-sectoral collaboration and accountability for adolescent health, including their sexual and reproductive health and rights. Normally, when we mention the word sexual reproductive health and rights for adolescents, it raises eyebrows. But it is as simple as saying when a girl is raped, her rights to being safe is violated. So that's a rights issue. So the other second thing is to really see government is setting up mechanisms for these programs to work, for these different sectors to work together. So as civil society, you need to follow this up and see what opportunities for accountability multi-sectorally does this offer for you, so you can leverage it. The other third thing is you just won't succeed if you're not going to have age and gender disaggregated data across all the relevant programs. You need evidence to put your case, but we also know at the moment data is a very big challenge. Some sectors are very developed when it comes to data, and for that matter, age and gender disaggregated data, but some programs are not yet good at that. So that's also something that we think you can leverage on or strongly advocate for, because if you're able to have evidence, it gives you the ground for engagement as civil society. Second and last, we also do think time has come for dedicated financing to be allocated on some of these issues. So you can think of dedicated financing if we are looking at the access to justice program under the sub-program under the governance and security program. It's time to have conversations on access to justice for children. I know in the other space, the gender activists have really lobbied so much that access to justice for GBV has taken shape to an extent that sometimes, you know, special programs have been put in place just to expedite access to justice for women. And I do think the same model can be borrowed by you, civil society, who are interested in securing access to justice for children whose rights have been violated. So it's also time to start thinking of dedicated financing within these structures to address special gaps that hinders access to justice for children. Second last, multi-sector collaboration and programming among civil society. What we are saying also is, as civil society, you also need to start thinking more collaboratively. Things are shifting. I can assure you, with the donor landscape shifting, the way of working among you, civil society, also needs to shift. I think donors will increasingly shift from working with one civil society to working with consortium. So you need to start thinking of working collaboratively and working multi-sectorally, because that's the kind of outlook we see happening. And lastly, private sector has been mentioned, and the creative and arts industry has been mentioned. Sometimes you wonder if all these sweet songs that people dance to were structured around transforming social norms that makes life difficult for adolescents, wouldn't we call social norms change? Right? So all these are untapped opportunities that you need to look into. And I had the dialogue, the panel talking about strategic partnerships, but with who? Yeah, strategic partnerships with who? So I think this is another untapped potential. If you look at all the artists, whether in northern, central, eastern, and then, artists are also becoming darlings, you know what I mean? So why don't you interest them in becoming change agents? So we need to be very creative and use local resources in circumstances that we see funds reducing and the need for us to be more efficient with what we have. So these are just some of those brainstorms on how you can think more innovatively around financing for adolescents and for their well-being. I will end with a quote, a proverb which says, "A nation that neglects its adolescents is like a farmer who eats his seed corn. It may fill today's hunger, but it will generate tomorrow's famine." I want to leave you with this quote, and I just put my appeal again to say, this is not just conversations we do for the sake of conversations. We are having conversations around the future of this country. Thank you so much, and I will end here.
She deserves a more hand clap, a bigger hand clap. Thank you very much for that kind of conversation and discussion. It has been very rich. A nation that ignores its young people is like a farmer who eats their seed. But also you know that a nation is as good as its young people. So for Uganda's sake, the young people that we see in the streets, in the slums, in the countryside, yeah, that's who we are. But also the young people reflect the quality of the adults. So as a generation of adults, it is incumbent upon us to nurture the next generation. We are now concluding. We are going to have a very short panel conducted by the Akina Mama wa Africa team. And after that, we shall leave. So, the panel, kindly come and take your seats as we get a few remarks. Yes, so as the Akina wa Mama wa Africa team gets ready, Mr. Henry Semakula is here. He wants to say a word before he departs. Meanwhile, the panelists can be coming as Mr. Semakula communicates.
I can't because I have to introduce them.
Thank you so much. Good evening, young ladies and gentlemen. My name is Semakula Henry, and I'm an adolescent working at the Ministry of Education and Sports. Call me old if you want, but me, I feel youthful. So, just from what Madam Judith has shared, I just felt touched as a Ministry of Education official and thought in only 2 minutes, I'll just confirm one important aspect that she touched. One of the challenges we have out there in our schools is the challenge of mental health. We have had so many cases. In the last 2 years, we can list over 15 suicides coming in from our young people. But the big question is, what is causing these suicides? We as a ministry have felt guilty at one moment because part of the cause is possibly the school environment. When there's bullying, when there's too much pressure coming in for results, when there are exams all the day, when lessons begin at 4 a.m. and end at 11 in the night, things are definitely not well. But I just want to appeal to the young people here. When you are challenged mentally, please never think you are the only one. Never think you are the last one. Please seek support. Sometimes our mental health challenges result from our attitude to life, when we are always negative about everything. So when you feel those moments when you are very low, please come for support. Don't venture into drugs, because again, our research has shown that drugs have taken us too far. I just had a presentation with university students recently, and I took them through a number of students whom I know at university that had failed to complete, including a guild president. There's a guild president of one of the universities who was in third year medicine, but preferred to go drugs. And so he couldn't complete. And as I talk now, he's among those people you call mad. They're not supposed to be called mad. They only have mental health challenges. But yes, just to caution our young people, this is a very serious challenge. Please don't get there. Instead, go for counseling. Instead, think about life positively. Instead, do good things when you have negative energy. Try to transform that negative energy into good things, and you'll be good to go. Otherwise, peer-to-peer, we are thankful. As education, we shall always be good partners. Thank you very much.
Thank you, Mr. Semakula from the Ministry of Education. Now, Akina Mama Africa, kindly come. We needed Mr. Semakula to give us that information before he goes. He comes from our mother ministry as young people, as children, and he's in charge of guidance and counseling, university education, and our well-being as students.
Good evening, I believe, right now. My name is Mewa Zakarin, and I'm a Mekwe Youth Panel member, and Akina Mama Africa, that is leading the Mekwe program in Uganda. So because we have a lot of little and limited time remaining, I would love to call on my panels. First, I would call Martha Nyaburu, a youth champion, a member of the Youth Advisory Committee representing Straight Talk at the SRHR Alliance. My second panelist will be the lawyer, Patrick Murungi Ngasira, a legal consultant at the Women's Pro Bono Initiative, who supports litigation on SRHR, an advocate of the High Court, a graduate student at the University of Oxford. The next panel member will be Richard Kasauli Christopher, a health worker from Chisugu Health Center 3, with over 15 years of experience working with adolescents. And my last panelist, Honorable Moses Kabusu, a member of parliament from Kalangala district. You're most welcome, sir. So I'm really going to use limited time. I've introduced the panel, I believe. Well, today's panel is about intersectionality and the idea that different parts of person's identity, such as race, gender, class, and sexuality, and the ability overlap and combine to create unique experiences of discrimination or privilege. It recognizes oppression is not just one factor, but how many multiple social categories intersect to shape someone's life and challenges. I'm not going to introduce the Mekwe as a general program, but allow me to move to my first panelist, whom I'm going to ask a question, and that would be Richard Kasauli. So Richard, how do you apply the intersectionality approach when providing SRHR services to the adolescents?
Okay, good evening, everyone. Once again, I'm Richard Kasauli Christopher, Salongo to be in the next 5 years. That is how I usually introduce myself. For the young people, the reason as to why I say in the next 5 years is because I'm pushing abstinence. So let us abstain from sexual intercourse. Exactly. Thank you, Reverend. So I'm from Chisugu Health Center 3, which is a government facility. It is a private facility that offers free services, and it has a unique factor, just like any other KCC facility in Uganda. We do have and we do offer youth-friendly services. So everything I'm talking about, you can reflect to a government facilities that is in your locality. We have 7 of them. So in case I say something that we do offer in Chisugu, you can always go to any nearby health facility and you actually access it from there. So I want the audience to first understand what intersectionality is. Intersectionality in adolescent refers to the way different social identities such as gender, race, socio-economic status, disability, and sex orientation interact to shape the adolescent's experience, opportunities, and challenges. We in Chisugu, by help of an IP or different IPs, we did apply intersectionalities in our service provision. We actually applied an intersectional lens in our facility, and it has helped us understand the complicities, and we have designed interventions that have addressed the needs of different adolescent groups. How we have actually applied it, we have different diverse and inclusive staff. So these different diverse and inclusive staff, they do help give services to the different marginalized groups. We have language interpreters. We have deaf people that can actually help out the deaf. Then we have peer and peer-to-peer support, because we have a wide range of peer educators in our facility that help out to give services and information to the young people. Our facility too, just like any other health facility in KCC facility in Uganda, is disability friendly. If I talk about disability friendly, I talk about we have many language interpreters. So in case anyone from any region comes to our facility, just gets to know that is going to be handled, because we have many language interpreters. Then we have different peoples with different abilities in the facility, which act as linkage officers to these different marginalized groups. So if at all you feel you're marginalized, you can come to our facility, you will be handled. Then we have addressed culture and societal barriers that prevent young people from seeking sexual reproductive through sensitization. So we have sensitized our communities, and we have actually helped young people access these services without any fear. Lastly, we have embraced technology. As I'm talking now, we are actually using an app called Tico in all KCC facilities that actually is helping out young people to access sexual reproductive health services. What Tico does, if I told you a young person and you come, get enrolled on Tico, first they are going to give you a reward for you coming to access a service. So meaning, if at all they give you a reward, that reward is in terms of money. In case you access a sexual reproductive health service, you are given a token of appreciation for coming. Meanwhile, what we expect from you is to go and advocate for the facility to get us more young people, so that we can have many young people accessing the service. Then the Tico app too can help a young person whenever they are to access information. You can ask Tico, or you can call their toll-free lines, anything that you may need. The other bit is that Tico has helped young people rate service providers. So in case you don't give a quality service to a young person, just know that at the end of the service provision, they are going to rate you. And if they rate you badly, it means that the team of that department are going to engage with that particular health worker and actually rectify that problem. Thank you. I hope I've done justice to that.
Yes, thank you, Richard. That was very elaborate on how you actually gave services to the adolescents at Ijisugo. So I'll come back to our young person, Martha. And in your experience, Martha, how do factors like disability, economic background, affect the way young people access SRHR services?
Okay, thank you very much. My name is Martha Nyaburu, a young person, as well as a member of the Youth Advisory Committee at the SRHR Alliance. So, in my lived experience, the following affect SRHR in different ways. We have gender. In most cases, some young people don't usually know gender the way it is actually how it is, but I would like to resound it for those who don't know it, because these are socially constructed roles and expectations from the community. So in most cases, when it comes to gender, here we are going to see what a man does or what a man does not do, and what a woman does and what a woman does not do. So in an aspect of how gender can affect how one can access SRHR, we are having issues whereby gender roles and expectations, that we're going to have a girl who's not expected, a girl who is expected to be married off. Now, in their context of the society, this girl has to be married off. She's going to be denied the right of accessing SRHR in terms of maybe getting family planning or information about child prevention, or even not getting married off. We are having cases of GBV that are affecting both girls and women, both girls and boys, only that it's more bigger to the girls' side. Then also, when it comes to gender, we have the stigma and shame. There is a lot of stigma and shame shaded on different gender roles and expectations. For instance, if a man is going to visit a health center, maybe this man, I would give an example of an STI, and he's not feeling good. There is a way the community is stigmatizing that men are strong, men should not fall sick, men should not go to health facilities to seek for their health care. So in this way, you're robbing of them the right of going to access these SRHR services. We are having another case of the disability. People living with disabilities in most cases are considered as outcasts in our communities. In which way? I'll take an instance of the facility I'm actively involved at, that is Wambo Health Center 4. It's a government health facility operating in Nansana municipality. So in such a case, for all the years that I've been there, I've not yet seen any person attending to people living with disabilities. Take an instance of a person having a hearing impairment. I've not yet seen any sign language interpreter who's going to attend to this person. Sitting at the youth corner, we get such people, but we fail on how we are going to help such people to access SRHR for their betterment of their future. Then also the stigma and discrimination that these people come with. There was a time when some young person came on. She actually, her legs weren't working, so she was in a wheelchair. So when she came to access family planning, someone was like, "Nabalema family planning zagazachi. Why you guys also go for sex? Why don't you leave it to people who are fine?" So in such a situation, this person is discriminated and also judged, which is going to limit their chances of getting SRHR. There is also an aspect of economic background that is limiting the SRHR access. There are cases where our government health facilities cannot provide all the services that are needed down on the routes to get SRHR services and to spread them wide to all the people. I've seen this happen several times, because having a youth corner in a government facility it in most cases helps us to actually separate the young people and be worked upon at a different spot. In which way? When the NDA is bringing drugs to our facility, we make sure that we make a requisition special for the youth. So just in case these youth come, they have their special medicine kept in place. But time is going to come and these medicines are over. And this person has come with a case that needs to be handled. Then you're going to tell them, like, you have to go and purchase this because it's needed at that point. And the person is like, truly, I don't have any money. It's not like you're denying them the right, but also their economic background is trying to limit them from accessing what they need. For the interest of time, I'll stop there. Thank you.
Thank you, Martha, so very much. I will then go to Patrick Murungi. And I want to specifically ask you, at the legal point you stand in, how do the existing adolescent SRHR policies address intersectionality?
Thank you so much. So in terms of the policies that are available, we specifically look at what are those policies that are in place to address these SRHR issues. So SRHR issues, we're looking at HIV, we're looking at abortion, safe abortion, we're looking at contraceptives, we're looking at sexual violence, menstrual health, we're looking at teenage pregnancies. So what are those laws that are in place that can help us address some of these issues? Number one that I can point to is the National Policy Guidelines and Service Standards for SRHR of 2006. That policy specifically addresses most of these SRHR issues, from HIV to safe abortion to contraceptives and all these issues. So it's a very, very important policy. Number two is we can look at the HIV and AIDS Prevention and Control Act that is specific and very clear on HIV prevention. Number three, we can look at the Domestic Violence Act that can come hand in hand with the National Policy on Elimination of Gender-Based Violence in Uganda. That's a very key and important, those are very key and important legal documents. We can look at the Persons with Disabilities Act, which we have a very recent act of 2020 having put in place, having repealed the one that was of 2006. So that's also very critical in that. So in terms of looking at these laws, in fact, we shouldn't even forget the Penal Code Act because that's also important. Then we have the re-entry guidelines for teenage pregnancies that are specific to schools, at primary and secondary schools. So these are important that in situations where girls are pregnant, they should be allowed for a certain period of time where they can be in school, but even when they give birth, they should be allowed to come back into school. So the context of intersectionality is that there are those people who are affected by these multiple social identities. That you'll find a girl who is in the village in maybe Amudat, she's already affected because of her economic status. She's a girl because of her gender. This is a girl who is maybe 15 years of age. So even her age is a factor in that. You'll find probably she's HIV positive, so that's also a factor that then affects her. So these intersecting social identities mean that they are unable to realize their potential in this context. So that is why these laws are present, are in place to make sure that they can elevate them to a certain point. Thank you.
Yes, thank you so much. That was very enlightful. Then I'll go to our last panelist, and I believe he carries a weight with his, how can I say it? But anyway, he's a member of Parliament of Kalangala District, and with you, I'll ask this question. How do the current adolescent SRHR policies in Uganda consider the diverse needs of the adolescents and the young people generally?
Thank you. Once again, I'm Moses Kabusu, a member of parliament from one of the marginalized districts in Uganda, in Karanga, Lasese Islands. I know they have here people from Karanga, I greet you. Now, they have discussed how intersectionality is an issue and how young people are affected by the intersectionality issue. However, as a legislator or a policy maker or a duty bearer in this category, I want to communicate to young people that much as their needs and challenges as you have been discussing them here, there are existing legal framework and policies that address these challenges. A law relating to, of course, I had wanted to Council could have talked about it. The Ugandan Constitution does not permit people to be discriminated. Article 21 of our Constitution prohibits discrimination. It promotes equality amongst everybody, be it you are a lady, a girl, a person with disability. Nobody should be discriminated because of his sex, race, age, and all that. So our young people out there where you are, just know that Uganda has the best legal framework that provides for opportunities for all of you to champion for your causes, to demand for your rights in every space that exists for you. Government of Uganda made it possible that every school-going age person in the localities there can at least have access to a nearby school. This one does not only promote awareness, but also builds confidence in our young people. As you are aware, an educated young person can demand for what befalls them. Yes, some are still shy, some have vulnerability here and there, but they are not ignorant or they are not illiterate. So the policy to education for all is itself an enhancement that a young person is able to demand for what is for them. Yes, now health, regarding health, the government of Uganda or parliament has been enlightened about the existing policy to do with the health. Like education for all, also health, in the earlier days, it was a problem until government came up with an idea that at least at every parish level, there should be a health facility at level 2. They are called health center 2s. At a sub-county, there is a health facility at a health center 3 level. At a constituency or a municipality level, there is a health center at level 4. And almost, not all, but there are several districts now that have district hospitals. Now, the policy that promotes availability of health centers and health service providers to near to our people is an enhancement to where our young people can find services relating to adolescent, sexual, reproductive health, and their rights. We want young people now to ask you to go to those health centers and demand what belongs to you. I have been to some of the health centers myself with the help of your teams, and our health workers there have told us, yes, they have weaknesses here and there, staffing, structures, but at least they tell you the way they handle young people if they come, and it's a policy that helps us. However, I know out there, even with the education, even with the health, some marginalized districts or districts with geographical challenges. I've been to Bundibujo, we were together in Terego and Maracha. We have been to Karangala, where mobility is a challenge. But we still urge everyone who picks the concern, including the civil society, government of Uganda, to extend these services, reach closer to our people, such that even the young people and everybody who needs services accesses them. The laws relating to disability here in Uganda, you realize when we talk to young people, sometimes it's a challenge. They may not know what was there before they were born. But at least every one of us here knows how Ugandan legislation has evolved to involve or to include people with disabilities. It's a command or a directive that every structure being built for the benefit of public must have are they called ramps, walking ramps, where our people, young people with disability or anybody with a disability can be able to push their wheelchairs, the buildings. Well, most private sector have lacked either sensitization or education about the structures, but at least with the increasing knowledge and availability of legislation or regulations prescribing the nature of structures, our young people, even those ones with disabilities, can walk to health centers, can push their wheelchairs to where they can get better services. I submit.
Thank you so much, Mr. and Honorable Moses, sorry. And I don't want to ask my panel members any further questions. However, the Mekwe young youth panelists and youth from Terego, Mbale, Kalangala, Makindye, Mukono have come together to write a position paper which will be submitted. But however, their call to action is that the youth panel and the youth champions from Bale, Kalangala, Gulu, Kampala, and Terego, plus Mukono under the Mekwe program, urgently calls upon Ugandan government, health authorities, civil society, and youth leaders to urgently address barriers preventing vulnerable youth from accessing sexual and reproductive health and rights. And when you do this, we'll be gladly included, and be able to also access and enjoy our SRHR. I'll give all my panels 1 minute to close out and say thank you to the audience for just being here.
Okay, thank you, Corinne. So now as I close out, this is to parents, because ideally, I want to talk to parents and adolescents. Parents, I don't know whether it is cutting across all the parents that are in the building. Most parents tend to shy away from sharing information concerning family planning, condom use, and other sexual reproductive health information to their children in a way of protecting them. But that is not protection. It is actually sending them to the challenging world. So we have reached an extent of sharing information to the young person at the facility, but since the young person worked with the parent intervenes in the health talk and actually questions what you're telling the young person. You want to teach my children how to use a condom? Really? No, you're not going to do it. Then after a few months or years, it is this same person that comes with pregnant-related issues, or comes back when they are what? Pregnant. So my humble appeal to parents as we close, please help us and talk to the young people, because they hear you more. Then when they come to health facilities or our health facilities, we shall just actually add on to where you stopped. But I urge young people to be very keen on protecting themselves. Please abstain from sex. Say no to transactional sex, because it is the common thing right now. So thank you very much.
Thank you so much. My closing remarks are specifically on information. I think that many times we approach the debates around sexual reproductive health rights with so much lack of information. I have seen it even in our legislative house. I remember when the discussion on contraceptives for 15-year-olds came into the house, there was so much discussion that was based on ignorance. And so it's important that we approach most of these discussions so much with information, because then that helps with the resolutions and how we move forward. Thank you.
Right. Thank you. As I conclude, I'll put a call for action, reminding that everyone has a role to play as we advocate for adolescent health. It's not I alone, it's not you alone, but as we get out of this space, whatever we have heard, whatever that they have talked of, let's try as much as possible to see how we can implement. No one is going to come to remind you that let's do this, because I believe all of us here are here to try to get something that will impact change in our communities. So the right time to act is now. Everyone has a role to play, and let's act towards providing better SRHR services as we also put intersectionality into our minds. Not forgetting, we are having evolving funding issues, so that's a problem everywhere, but I would urge everyone to use the available structures such that we can try as much as possible to work within the budget. Because I personally am not that very much funded, but as long as you have that call for action to serve your community, then use what is available. Share this knowledge and share it for the better, for people to be informed and make informed decisions. Thank you very much. A big round of applause to all the CSOs and the government of Uganda. Thank you.
I also want, maybe, I'm sorry I was not with you all yesterday and at least half of the day today, but when I discuss or meet stakeholders like you are gathered here who handle adolescent sexual reproductive health challenges, Parliament passed a law, it is commonly known as AHA, the Anti-Homosexuality Act. And what Parliament intended to do, that notwithstanding, you people who are working with our communities, they are down there or in your communities, they are children who are either victims of what the law prohibits, and because the law is available, many of you fear to even identify them or to hear from them. I want to ask you, as civil society organizations working with young people down there, identify these people. Some of them need help, need to be spoken to. They need to be confided. And probably, if Uganda will, in the near future, look at that matter as one that needs to be reviewed, the people who will have been victims of the situation and circumstances should not go and hang or die away. They need also to be guided, because all that is also sexually related. That's my call to you as civil society. Thank you.
Okay. Thank you so much, Kina Mama, for that session. I know that we have now understood what intersectionality means in the spirit of adolescent health, but also marginalization when it comes to young people and adolescents. I will not repeat what they discussed, but you can still go and learn more about it. So at this time, I wanted to invite Afande Muchunguzi to just give us some highlights. He has been here with us for some time, and I know that he's an advocate of a good judicial service for young people, but also from the response side of the police. You're most welcome, sir. Yes.
If you're happy and you know, clap your hands. If you're happy and you know, clap your hand. If you're happy and you know, I really want to show. If you're happy, say I am. Hallelujah. A very big hand clap for the organizers. And a very big hand clap for the panelists. A very big hand clap for yourselves who have remained here. And a very big hand clap for God, if you hate yourself at least. Wow. I'm Senior Superintendent of Police Jackson Mchunguzi. I'm a senior police officer at the Department of Child and Family Protection. My desk deals with men who are suffering from gender-based violence, who are beaten by wives with the help of children. So, and I have very many clients, so in case you're there and they are giving each boko, come and we sort it out. Today we are here for the adolescents, and indeed on behalf of the government of Uganda, the Inspector General of Police, we want to thank you for sparing time to come and be with us on this great day. The health of the youth is the wealth of the nation. And therefore, we must invest in adolescents. Life has no spare parts. If you go there and humanize as much as you want, HIV does not know that you are a youth. You will die. Not every hole that you meet on the way, you should enter. Hallelujah. And everything that you meet should enter you, okay? So the enter and empty should be very careful. Are we together? So healthy adolescents equal to healthy adults, and therefore into a healthy nation. We need to be so intentional. All that they have been saying here, the problem comes from home. Men are absent, women are hostile, children are doing what they are doing. Oh, there is confusion. And if we want to do much better, then we need to invest into the institution of family. The future belongs to the youth, and even we must remind you that you are the owners of this generation. Uganda is so lucky that it is among the best 5 countries that has the youngest generation and population. But the question is, what are you doing as adolescents? Every adolescent deserves access to quality, healthy education. Security begins with you. Before you blame police that where are you? Have you kept yourself safe? Some of you are risking life and you are not bothered of what could be happening. The true character of a society is revealed on how it treats its children and youth. Therefore, youth, we call upon you to avoid the sexual immorality that is eating you. The sexual immorality, I mean, if you are below, if you are not yet married, please abstain. Are we together? Yes, but you find that boys and girls are being affected here and there, and which is very dangerous. Avoid drugs. Drugs are a problem. You are smoking shisha, marijuana. Eh? Youth are doing things that are terrible. There is one youth, a boy, who told me that I found it for me, I have 6 girlfriends. At 18, you have girlfriends, and you expect that life would be fair for you. The future of our children depends on the decisions we make today. Therefore, be mindful of what you eat, of where you go through. You saw a lady here who lost her virginity to a cell phone. And the Reverend was very clear that never you be eaten because of what? You remember that? Never you be eaten because of a cell phone. Don't be eaten because of chips, chicken. Don't be eaten because of credit data. You want to go on TikTok and they are eating you freely. So investing in children is investing in the future. We are banking on you because without you, the future is finished. So, ladies and gentlemen, a lot has been spoken since yesterday up to now. What we can tell you is that you must love yourself. One of the causes of mental illness that Honorable was speaking about, and other speakers, is because most people don't love themselves. You are so stingy to yourself, to the extent that you don't want to bathe. Do you know some people are very stingy that they don't want to bathe? Another one hates himself to the extent that he can eat 30 chapatis. Somebody can eat 30 chapatis at a go. That is hating yourself and being stingy. And therefore, we need to ensure that we are very reasonable. We have our vision and mission in whatever we are doing. East to West home. And therefore, what are you doing at home? Fellow men who are here, if you know that you are a sperm donor, you are a loss to the generation. Hallelujah. When you go and sleep with somebody and produce a child, go and look after that child. Don't cause regrets. This morning I was handling a case where twins aged 18 years sent a WhatsApp message to their parents that daddy and mommy, we don't miss you and love you. Imagine Narongo and Sarongo receiving that message. And they were up in arms. Very successful people. Sarongo is the CEO of a big company. Narongo is a successful business person in Chikubo. But children have said they don't learn anything from them. Why? They are absent. How much is too much? How much is too much that you are looking for at the expense of your children? You need to be there for your children. Proverbs chapter 16, 17 says that money in the hands of a fool is a curse. Therefore, continue looking for money at the expense of your children, you will suffer. We must be boring you, but we want to thank you for coming. Children, you mean adolescents, you mean a lot to the country. Say no to drugs. Say no to sexual immorality. You will never regret what you are going through. We want to thank you, and whatever they have taught you here, kindly go and implement them. I've said this for God and my country, Uganda, the power of Africa. God bless you.
Yeah, thank you so much, Afande, for a brief remark, but sensitive to this audience. I know that you want to interact more with Afande, so please, I know also, if we know your address, yeah, if we get challenges down there, as you missed our session in the morning with the Afande Reham. It was really, there are issues that perhaps you also will take up in terms of questions, but not all is lost. We can still contact you directly from your office and you support us, okay? So at this point, I want to invite how are we doing? We have a team. Yeah, Doreen Nabos, sorry. There is a principal, is a health worker. Are you around? Doreen, the health worker? Yeah, she was a panelist. Yeah, she was here already, yeah. We had a health worker in the house. So Pardon? Oh, yes, sorry. Sharon, you're giving me wrong names. You want me to be fine. So, Winnie, just 2 minutes. You also tell us your experience. Afande has kept time. So, you tell us your experience as a health worker, and then we shall invite our CSO director to come and help us close this August house that has been so encouraging and also engaging. So thank you.
Thank you so much.
Good evening, team. I welcome you all. I was nearly leaving. I didn't know that they had prepared for me some few minutes to talk to you. My name's Nachimbugo Winisanya. I am a public health specialist working as a district adolescent health focal person of Mityana District Local Government, and I sit at the Department of Health. I've been working with adolescents for the last 12 years in Mityana District, and the experience I have, to me, I think everybody who has been here have worked with that person. But the few minutes I've been given, I feel like I should talk about the duty bearers. The duty bearers, the role of the duty bearers in upholding adolescent rights. Many have been here, but we still have some gaps and challenges. When I talk of a duty bearer, is that individual or that the institution which has an obligation under the national laws, either international or national, human rights framework to protect and fulfill the rights of others. To me specifically, the rights of adolescents. As you know, adolescents have a right to health, a right to education, a right to protection from abuse, neglect, and exploitation. They have a right to participate in decision-making and access to justice. Relating it to today's theme, strengthening legal and justice systems for adolescent health and well-being in Uganda. Who are the duty bearers? The health workers. I'm a health worker under the Department of Public Health, specifically where adolescent health lies. We are supposed to give adolescent-friendly services using confidentiality, non-discriminative measures, referring and giving support. When I talk of referrals, we are supposed to be working with stakeholders like community organizations, CSOs, education departments, the law and justice, police, child and family protection units. We are supposed to advocate and educate policies and educate the adolescents on their rights. And then we are supposed to identify and report violation of adolescent rights. The teachers, I don't know whether I from Mityana, I came along with some teachers. Hopefully they are still around. But under education, we are supposed to avoid re-traumatization. We've got so many issues for adolescents who are taking ARVs. I can give an experience of a certain school where an adolescent was in a boarding school but refused to take drugs because every morning at the parade, the teacher on duty could say, "Go to class, except those who are taking drugs. I find you at P1 class." So others could ask, who are these ones taking drugs? Which drugs are they taking every day? So the boy told me, "Musao, the reason why I don't take drugs at school, I fear to join that group every morning after the parade. The teacher on duty says, all others go to class except those ones who are taking drugs." So educationists who are here, please, HIV is personal. You understand? Even you adults, men and women who are here, some of you take these drugs from where you cook from, others from your cars. You have friends where you first go in the evening, take the drug, then you go home. Then why do you expect adolescents to be exposed the way you do? Please, this should stop, okay? Then the government ministries like justice and gender, you need to develop laws and policies and allocate budgets to support adolescent rights. Whenever you are there, involve these people, please, in policy making. There is nothing you can make for an adolescent without that adolescent. You understand? Nothing for them without them. Please, involve them. Let them be inclusive in whatever you do. Because there are so many things that you think they are not doing, but they are doing them even more than you do. Yes. If you have adolescents at home and you are here, they are used that daddy, mommy comes back at 6. One time, just dip toy during the holidays at midday. You'll see what is happening in your homes. You'll just appreciate my statement. These are people who stay with the remotes, and one sits at the window. They are just waiting to hear of any noise, and then they change whatever they were watching. And they normally practice whatever they have watched. So please understand that these are human beings. Look back and revise your notes. How were you from 13 to 24 during those days? And then understand the type of children, the type of adolescents we are looking after wherever we are, whether in the community, or in schools, or at churches, and relate it to the day-to-day life, where our kids have phones. We leave them with maids, and with this, in this era of gayism. I think you understand. However much you are trying to do that, for those who are trying and others who may come up with it tomorrow after this conference, we still have challenges. There is limited capacity awareness. Please, CSOs and everybody who is concerned here, let us try to involve everybody. Let us do capacity building to each and every one. Health centers, health facilities where our kids come for health, they are poor services for adolescent health. They are not friendly at all, like one of them said. One time where I survived from, an adolescent of senior to 15 years came to the adolescent clinic and asked for emergency pills. Themselves was there, was very quarrelsome. How old are you? How can you ask for pills? But for us in health, we are telling them the truth, because we don't want to get septic abortions, illegal abortions, and we don't want to get unwanted pregnancies. For you people in communities, you feel we are abusing your children. But in health, we are telling your girls and children, if you cannot abstain, protect yourself. And the measures of protection are so many. Use a condom correctively and consistently. If you can't, and you feel you want to have sex, please use family planning. Okay? Because even if you don't tell them, they'll go in drug shops where there are no friendly services. The person opened up a drug shop and a pharmacy in the morning to get money. A girl of 13 will go and ask for injector plan, themselves will give, because of when chat and nakola. You understand? So please, however much you hide these things are happening behind our backs. Some of you parents, you even don't know how to calculate your safe days, but your daughter of 16 knows. The cultural norms and the stigma, the insufficient coordinations and integration of services. We need to integrate these services, because if at all a child is at home, tomorrow she will be in school, the next day she will be in the field fetching firewood somewhere. You also what happened during lockdown in our communities. Everything was at increase, yet we are parents staying with our children. Why? The teenage pregnancies hiked, the HIV prevalences hiked, everything, substance abuse. So with that, I recommend the following. Let us train or mentor the duty bearers on youth-friendly services. Let us establish and strengthen the multi-sectoral referral systems. Let us promote meaningful adolescent participation. The meaningful, I underline that, adolescent participation. We strengthen monitoring and accountability mechanisms, advocate for legal reforms aligned with adolescent and children rights. And then let us create safe spaces within our communities, either in health centers, in schools, and streamline our norms. As health workers, we are supposed to protect and empower, but not only treat diseases, because not all adolescents come to us when they are sick. We need to treat them comprehensively from the mindset. We give them services that are safe and confidential. A call for action is to shift from being passive service providers to active protectors of adolescent rights. I beg to stand for God and my country.
Thank you, Musao, for those wonderful remarks as well. I think we have gotten also more information about how to, survive, but also very insightful in terms of how your life skills as an adolescent. So the room is getting empty and empty. I want to really invite Jackie to give us the honors of closing this dialogue. Jackie is a powerful lady in the CSO platform. She also represents us in the global financing platform and also very conversant with the adolescent health programming. Welcome, Jackie. Yeah.
Thank you so much. Can we clap for ourselves? I might not be as lively as Afande, but I relate closely. I'm a mother of adolescent boys. And every day they tell me, Mommy, you're getting old. So later I'm beginning to see how to balance the boat because they are beginning to see some people, and I don't want to be labeled an outdated mother-in-law. Yeah, thank you so much, Honorable Member of Parliament who has stepped out, our representative from our government, the security department, the ED of peer-to-peer, and all the key guests who are here. I have been introduced. I wear many coats, but what is important, I'm a leader. I chair the RAMCA, that is Reproductive, Maternal, Newborn, Adolescent Health, Nutrition, and Healthy Aging platform. That platform brings together civil society and the global financing facility hosted by World Bank. So I'm here also to represent World Bank, both at global and national level, because I also represent CSOs at the World Bank governance body, which is called the Investors Group. But also I represent CSOs on HIPAC, the Health Policy Advisory Committee of Ministry of Health. I bring you apologies from Dr. Arrow, the Director General. I know he said he's in Makere. He was stuck in traffic jam. Just in case he walks in, because he promised that in case he comes before we close, he will come in. But if he doesn't make it, he sends your greetings from 1 p.m. He's been promising to be here. The same with Dr. Mugahi, who is again away there with the minister in Makere for an event. One, as RAMCA, as I said, we have a Adolescent Health Forum. We truly appreciate the work that you've been able to do. And I've been in this space. We have the chair of that forum. We have many engagements. It's the first time, as Judith said, that I enter a room and I get intimidated and feel so old. Because this is the real adolescent health dialogue. Young people speaking for themselves. Many times we enter these meetings and it's us speaking for young people. So thank you so much for the organizers. And I'll take this message back even to global level in the 36 countries that we represent of JFF and World Bank, that this is what they call the real action. We like talking for you, but today I heard what you're saying. Unfortunately, I couldn't be here for 2 days. I was in other engagements. As you heard, the platform has around 6 areas. So on a daily basis, somewhere representing, and but I was following closely with the ED. I will talk about a few things and I'll be brief. One, I was supposed to be here a little earlier, talk about financing, and I didn't get the opportunity. But I'll talk about 4 things regarding financing. One, and I wanted Mr. Wille to take note, because these ones I want us to work on them. One, you already talked, when I was entering, someone was talking about the 30% on PDM. Under the FP 2030 commitments and other commitments, adolescent health are allocated 10%. That means under the budget of the government of Uganda, there should be 10% to address adolescent health. But that has not happened. So we need to make sure, one, we track. One of the things we are smart advocates and the members know, we are not activists. We engage with evidence. We need to do a landscape analysis to confirm that out of 10, we don't have an allocation. And once we confirm, then we should be able to have another engagement, particularly to engage the decision makers on how to ensure that we realize the 10%. For those who are here in the National Health Financing Dialogue, you remember I raised it, the PDM, and the Public Health Director, Dr. Daniel Chabazile, confirmed and said, yes, the 30% is supposed to be for adolescents. And I asked him, so where is it? He smiled. We need to track that money. So those are two actions. We need to do a landscape, we track, and we engage, particularly on financing. And if it's being allocated, what is it being allocated to? I work for an organization called Faith for Family Health Initiative. It's an interfaith NGO. We work with religious leaders. We did investment cases for adolescent health and tracking of the budget in Uganda and in Toroko with the World Bank money. And right now, there was zero. But for Toroko, we managed to get some budget by the end of 2 years. That means it's possible. If we have intended advocacy, even if we don't get it at the national level, we can work at subnational level. We get these young people through advocacy and social accountability to engage during the budget process, and we get a percentage at that level. So we can share the models. They are very simple models, and they can be used by anyone. So to me, as part of the chair, we normally get some little funding. A grant should be coming out soon. We pray that it's competitive, but whoever gets it, we are trying to lobby that is a person who has a heart for the platform. We shall try to make sure that there's evidence, and we are able to track, and we are able to have a focused dialogue on adolescent health financing. If it doesn't happen, I'll still raise that money through my other circles. We treasure you, and clearly we know that you're very productive. As I said, many people don't understand young people. I'm always disagreeing with a number of people in my household who think the young people are really, they don't listen, but it's because of their language and the generational change. Because for them, they will call their dad nigger. You hear them in the corridor saying, this nigger man, and you ask them, so have you heard that nigger? So in a way, they don't actually disrespect, but that's their language, and should their dad hear them calling him a nigger, it will be trouble. So they are not bad, but we need to know that the generation has changed. But what is important is for them to know how to balance and know when to say what. And sometimes they tell me, then when I try to be young, then they call me, I've forgotten the name, but trying to show that I'm balancing between the young person and the old person, and then I look at them and smile. So in a way, we know that you're very productive and you can change. I've been a young girl, economic, and I know what it means. I have my own story. If you had time, I'll tell you. But I will tell you one story. It's very difficult as a young girl to get a date when you're hungry and you're able to say no. It takes God. So economic empowerment is very key. Focusing on young people to empower them economically, and we are missing that even in our policies. These policies we are talking about and the rest, that's lip service. But if you're hungry and someone, or you don't have school fees, many of the girls we see at the university, most of them are paid by even people who later marry them as property, and they abuse them. You can, because they've invested in you, you have no freedom. They will tell you don't go to work. You're their property. All those are causes of poverty.
But I know that we have looked at the position paper that it has all these actions. We are going to take it on. I'll have a discussion. We can have an engagement with the peers. But also we can take it to HIPAC and continue this discussion. Otherwise, congratulations. It was an amazing discussion. I followed everything online, and I thank you. My team from all over the country, I've met very amazing young girls, my daughters from Amdat and the sister, and many others that I didn't talk to. What a wonderful dialogue to have people. We've had an MP, I've been in this space, all of you who know me, but I've never met an MP from Kanangana. And those are the people who are dealing with a real hard to reach. So that shows you the uniqueness of this dialogue, and we promise that we will use every possible space to advocate for what you've discussed. Thank you so much. May God bless you. Health and other key people are supposed to be here, and CSOs. That is RAMCA, HIPAC, and the JFF World Bank. Take this opportunity to declare this incredible dialogue closed. Thank you.
Thank you so much, Jackie, for, again, those remarks. So, colleagues, now for the organizing committee, I don't know if you are here. Yes.